Hello, gorgeous. How are you? Welcome to Empowering Women in Menopause podcast. It's your girl, Trudie, and it is morning, a snowy morning here in Toronto. And on this week's episode, I have a guest. I told you, ladies, I know a lot, but I do not know everything, and I do not pretend to know everything. And I love to invite other awesome women on who has different specialties but are able to help you. This morning, I have Aliya on the podcast, and the irony is we still have yet to meet in person. We've been trying to connect, and Aliya is a pelvic floor specialist. She helps pelvic floor physiotherapists. I will let her introduce herself and talk more about what she does. Hey, Aliya, thank you for joining us today, darling. How you
Hi,
doing?
hi, Trudy. Thank you so much for inviting me. I'm so happy that we could finally make this work, and we will meet in person one day. I know it.
Yes, so you tell us a bit about you, what you do.
Okay. Well, as you said, my name is Aliya. My name is Aliya Dhalla. I am a pelvic floor physiotherapist here in Toronto. I have my own clinical practice here downtown in the city, where I see mainly women or those with female reproductive anatomy, and I basically work with people to help them manage their pelvic floor issues, right? So this can be bladder dysfunction, leaking, urgency, things like pelvic organ prolapse, bowel problems like constipation, hemorrhoids, this type of stuff. I work with a lot of people to help them prepare for birth and recover postpartum. And over the last 6 to 12 months, I've been seeing a lot of women sort of around my age, early 40s, mid, late 40s as well, sort of trying to optimize and sort of address things that have started changing as we enter perimenopause. So that's what I do with my clinical practice. I love the work that I do. And I also have some sort of online educational content that is available. I like to hang out on Instagram and teach people all about their pelvic floor and share tips and exercises. And my handle on Instagram is at Box Wellness Co. And then I also have my own podcast, Trudy. I'd love to have you on as a guest. And that podcast is called the Not Your Mother's Pelvic Floor Podcast. And again, just education, conversations with guests, kind of exploring and unpacking the types of conversations or teachings we were given growing up about our bodies, about puberty, periods, sex, birth, postpartum, and menopause, and sort of having these conversations out in the open. Basically, just like talking about the things that we don't talk about, but we really need to be talking about. So that's what I love doing on my podcast. And then I also have sort of online programs and courses that are available to help to, address pelvic floor symptoms like, leaking and prolapse and pain, and also to prepare for birth. So that's kind of what I do from a professional standpoint in a nutshell.
Yay, thank you so much. And yes, we have to coordinate something for me to be on your podcast.
I'd love that.
So I love defining things. I find by defining things, everyone's on the same page with exactly what we're talking about. Now, you're a pelvic specialist. What is the pelvic? What does it consist of? You know,
Yeah,
why is
that's
it
a good
important?
Yeah, that's a good question. So I am a pelvic floor specialist. So what is a pelvic floor? I guess we can start there. We all have pelvic floors, like women, men, we all have pelvic floors. Essentially, what that is it's the bottom of our pelvis. So if you put your hands on your hips and you feel your hip bones at the front, right? That's your pelvis. Okay. That's
Mm.
your bony pelvis. And if you kind of put your hand down to feel your pubic bone that is a bit closer to kind of like your privates or your crotch area, that pubic bone at the front, that is part of your bony pelvis as well. So the pelvic floor essentially is just the name that we give to the soft tissue structures that make up the bottom or the floor of that bony pelvis. And the pelvic floor is made up of a set of muscles. There's connective tissue like ligaments and tendons. There's blood vessels and nerves. And also, there's holes, right? With female anatomy, we have three holes in our pelvic floor to allow things to go out and in. We have one hole, for the poop. We have another hole that would be the vaginal opening. So things like a baby would come out if we have a vaginal birth, but also discharge and menstrual fluid would come out from there. And then if we wanted to insert anything into either of those holes, we could. And then we have our urethra, which is the hole where the bladder empties from. So basically, the
Mhm.
pelvic floor just is the structures down there. And the pelvic floor itself, you know, most of us don't know what the pelvic floor is. And that's a good thing, I actually think, in a way, because those structures are supposed to just do what they do for us. They're just supposed to work in the background and they're supposed to, ensure that we empty our bladder and bowels at the right time, right? Like at the right time, at the right place with little effort, right? Um, it's again, those muscles and those structures down there are supposed to allow us to experience, sexual penetration if we want and sexual pleasure. They're supposed to do all these different things that are sort of happening in the background. And often it's when something shows up that we experience some kind of bladder, bowel, sexual dysfunction, or we are, into our pregnancy or postpartum journey that many people are like, oh, I didn't even know this part of my body existed. I didn't even know that I could have a problem down here. And now I do. And perhaps they're Googling or they're asking their friends. And that's when maybe they start to become aware of this part of our body. So I think it's actually really normal that most of us don't know what it is or where it is.
We just kind of have it. And as you
Mm-hmm.
said, something goes wrong,
Mm-hmm.
then we're like, okay, what's going on? And I
Mm-hmm.
want to get into a few questions later as opposed to what could go wrong and some symptoms.
Mm-hmm.
Since this podcast is specifically for perimenopausal and postmenopausal women,
Mm-hmm.
how does the pelvic change as we age? And how about changes that may be associated with peri and postmenopausal women?
Okay. Yeah, this is a good question. And it is like a common time where things show up for the first time, like, problems show up for the first time, or existing problems that maybe weren't so bothersome become more bothersome as we enter into those perimenopausal, postmenopausal years. And there's some main reasons why we might experience some changes or some symptoms. Firstly, as we age, our muscle mass just naturally, we have an age-related decrease in muscle mass all over our body, right? We know this.
Mhm.
Starts in our 30s, we lose a certain percentage of muscle mass year over year. It doesn't mean that we can't gain muscle. It just means that we're working against age and time. And so the muscular support of our pelvic organs, right? So our pelvic organs are bladder, uterus, if we have one, and rectum. Our pelvic floor muscles are one of the support systems for those organs to hold them in their rightful place. Also, the muscles of the pelvic floor help us to keep continent or to help us keep our pee and poop and farts in, right? So, if we start to experience some age related muscle mass decrease or function decrease, we may experience some symptoms of that. We may feel like our pelvic organs might not be held up in place well enough, maybe with that muscular support system sort of declining a little bit. Or we may notice that, wow, we can't hold our pee as much anymore. We're experiencing leaks, right? It could be because the urethral sphincter, that's the muscle that's around the urethra that controls the pee coming out, that maybe that muscle is also kind of losing a little bit of strength, which is normal. We do lose a little bit of strength with each decade. So there is the muscular support, right? There is that factor because our pelvic floor, i- a lot of it is muscular. Like I said, there's other structures like ligaments and tendons and blood vessels and nerves, but there's a lot of muscles down there, and they do have an important job mostly to work kind of behind the scenes or automatically. When muscle strength starts to decrease, we could experience some downstream effects of that in terms of bladder, bowel dysfunction, even sexual dysfunction too. Another huge contributor to why we may start to experience certain symptoms during perimenopause and postmenopause is because of the hormonal changes that are happening. There's changes in estrogen, progesterone, and testosterone throughout our body as we're going through this perimenopausal sort of roller coaster, if you will. And
Mhm.
the tissues of the pelvic floor, the tissues of the vulva and the vaginal tissues, they really love hormones like estrogen. And as we go towards menopause, right? Menopause is just one day on the calendar when you haven't had a period for 12 months in a row. As we're reaching that date on the calendar, our hormonal levels are fluctuating. And one of the hormones that is fluctuating and likely over time trending down is estrogen. And the lack of estrogen in our vulvar and vaginal tissues can contribute to some of these sort of like leaks, the muscular support, even symptoms like that feel like a UTI, like
Mm.
burning or stinging, even sort of thin and very delicate tissues that we might experience that when we have penetrative sex. It never used to hurt, but now it hurts, or it's really dry, or we get little teeny tiny tears in that delicate tissue. There is the hormonal contribution there as well. There's so many hormonal fluctuations as we move towards menopause and beyond.
I myself am learning so much. I do know about the importance of estrogen in so many other areas, except for, because when most women hear about estrogen, they automatically think of the sex hormone and reproduction. I don't
Hmm.
think a lot of women actually do the association between estrogen and our pelvic. But as you said, estrogen is important for those things.
Estrogen, like there's estrogen receptors all over our body, all
Mhm.
organs and like joints and all systems are affected by this change in estrogen status, including our brain. There's really, really cool research coming out that's just explaining a little bit more about why we have such widespread symptoms in perimenopause and menopause and postmenopause, and the really important role of estrogen in sort of these symptoms. It's just nice to have an explanation for why some people experience all different kinds of symptoms all over the map, right? Brain fog, insomnia, joint pain, um, uh, irritability, mood swings. Like there's so many things that are going on, hot flashes. There's so many things that are going on that sort of span all these different systems of our body. And it's not like we can, I think, blame everything on estrogen, but estrogen certainly has a role that we're starting to understand more and more. So it's kind of exciting.
What I'm loving the day and age we live in is, as your podcast says, not your mother's podcast, not your mother's pelvic floor. For most of us, our moms and the women around us went through this and they had no resource because most doctors still aren't trained, even gynecologists, a lot on women's body, women's hormones, women's reproductive system. And I'm so happy that we're in a day and age where there's more information, more research, because research usually takes like what, 15, 25 years for us to actually find the results. And I feel that now we're actually getting the results. And I'm so
Mhm.
happy because then now I feel like we're becoming a bit more educated so we can understand our bodies more and the changes and of course what to do as opposed to, oh, well, it's perimenopause, oh, it's menopause, that's normal, and carry on. Okay.
I agree. I
Something
think
that I
that
love to say is while a lot of these things are common, they are not normal.
totally. We don't have to suffer necessarily, right? And I think nowadays, if we want to learn more, there is more information available to us than like ever before. And I think that can be overwhelming and that can be good and bad too, because that means that there's not very good information out there that sometimes it can be very hard for us to put our sort of critical thinking hats on and be able to tell what is accurate, evidence-based information and what is just like someone trying to scam me or scare me or prey on this vulnerable point in time. So I think that it's a double-edged sword, but I think that if we want information, um, we have access to it now. So it is an exciting time, and it's not going to be our mother's menopause, right? Because they just kind of suffered through it, maybe joked through it, maybe had nervous breakdowns through it, but hopefully we have some options and it's through conversations like this that we can have these conversations and make other people feel less alone because I think it's just a trick that our mind plays on us that when you're going through a rough point in your life, whether it's like health or relationships or mood or anything, right? You think that you're the only one that's ever felt like this, or you're so alone in your experience. And I actually think that we're just so much more similar than we are different, and we're not alone. Everyone is going through something hard, and the more that we share these types of conversations and normalize talking about the stuff that we're all going to go through, like everyone that has a uterus, right? Whether you have kids or not, you're going to go through perimenopause and menopause. it doesn't matter, you're going to get there. So it's nice to have these conversations as like an outlet for people to listen. And if they feel ready, then they can also talk about it, right? And I think that's helpful.
Exactly. Um, what are some signs or symptoms that a woman has a weak pelvic floor? I know some of these, and I'll let you describe, and then I'll share one of my stories, one of my personal stories.
Okay, okay. This is a good question. I think that many people, I think people want to have a strong pelvic floor, right? We want to just have strength and we think it'll solve all of our problems. And I hear this a lot in the context of like women and leaking, right? Oh, I leak because my muscles aren't strong or whatever. Or people thinking that they're not doing a good job with their Kegel exercises that, their doctor or the internet told them to do. So let's talk about what a weak pelvic floor might look like. And then I have like a little sidebar about that. But a weak pelvic floor could look like yeah, leaks, right? So leaking when you sneeze or cough. That could be because of muscular weakness. A weak pelvic floor. You could also have hip or back pain, right? The pelvic floor muscles are part of sort of our internal, our deepest core system. They play a big job in helping to stabilize our body as we move. And so weakness can show up as pain elsewhere, pain in the hips or the pelvis or the back itself. The weakness of the pelvic floor can maybe end up presenting like feeling like something's really heavy or low or pressure, something is sitting low in the pelvis, or like more commonly, people will say, like, I feel like something is in my vagina or going to fall out of my body. Perhaps
Mm.
if the muscular support system isn't so great, then we could have that sort of, poor support system for those pelvic organs that sit inside the pelvis. So those are like most commonly what I would see with weakness of the pelvic floor is some kind of dysfunction with bladder control. We can also experience the inability to have an orgasm or difficulty orgasming if our pelvic floor muscles are really weak because, um,
Yes.
yeah, you're like, more, tell me more. So I think that's sometimes when I share this piece of information, people are like, wow, I had no idea. But so I don't know, maybe Trudie, you'll have the same reaction. But an orgasm, what we feel is a involuntary contraction and relaxation of the pelvic floor muscles themselves. Like that's what we feel when we climax. So if our muscles are not strong enough to have like really nice contractions, we may not feel that intense of an orgasm, or we may not be able to get there. There's obviously many other reasons why we may not be able to have an orgasm, but that is one of the reasons. It can have like weak orgasms because our muscles are not quite strong enough.
Okay. And the irony is I know of a few of my clients who's been telling me about that. But
Yeah.
my story with leakage, because I I feel like most of us have our bodies and we don't fully understand what our bodies are meant to do and not meant to do. Because I
Mhm.
remember I'm 45, will be 46 in a few weeks. And I remember
Mhm.
when I entered perimenopause 4 years ago,
Mhm.
one of the things that shocked me was leakage, meaning the minute I felt like I had to pee, it was like I had to literally bolt to the bathroom because I felt like I was leaking.
Mm.
I'm like, but I've never had children. I thought this was only issues women who's given birth experience. That's what I thought because it's like, okay, the pushing weakens
Mm.
it. And I'm like, what is going on here? And then I do weight training, but I noticed once I started lifting heavier over time, that subsided. But I just found that so ironic. It's like most of us think that, okay, we'll never experience leakage of any kind if we've never had children. And clearly, that's not the case because as we age, as we know, we lose strength, muscles become weaker if we're not lifting heavy enough to combat that.
Yeah, it's such a common misconception, right? That, oh, we can only have pelvic floor issues if we've given birth. Um, and like I will say that it is a time in our life that does change things quite a lot down there. Absolutely.
Mhm.
Having children does increase I think the probability of having some kind of pelvic floor dysfunction, it's kind of hard to deny that. But it's not just like a pregnant person or like a mom problem. But that is like a very pervasive way of thinking. And so I can totally relate to what you're saying because, many of my patients, for sure, many of them are pregnant or have had children, but a huge chunk of them never have. And they're coming in to see me for all kinds of issues, including like leaking with exercise, leaking when they get the urge, right? Painful sex, pelvic pain, all different kinds of things that can show up whether you've had a baby or not. So yeah, it's very interesting. And one thing to kind of maybe just drop a little seed um, down about is that we can have lots of problems down there or dysfunction with our pelvic floor muscles that doesn't have really too much to do necessarily with weakness, but could have to do with like dysfunction of the muscles themselves in the sense that the muscles may not be like loosey goosey and stretched out weak. They may actually be short or they might actually be tight. And that tightness is not necessarily a good thing and can cause like a whole bunch of problems from
So,
leaking.
Aliya,
Yeah, yeah,
in
yeah.
regards to that, let me interrupt you and ask a question.
Yeah.
How would we know the difference if it's a strength
Yeah.
or a flexibility problem? Because you're
It's a good
explaining
question.
that. How would we know the difference?
It's a very good question, and honestly, it's really hard to answer because this like signs that you might have tightness, they overlap with weakness quite a bit.
Mhm.
Like you could have leaking because your muscles are a little bit overactive and therefore they're not actually like a very functional muscle. You could have back pelvic pain because of that. You could have you could have sensation of pressure or heaviness because your muscles are kind of clenching in too tight. You could have pain with sex. You could have difficulty emptying your bowels. You could have a hard time going pee without pushing your pee out. There's actually like a lot of things that are going on that can mess things up with how your pelvic floor muscles function if the muscle is too short. So it's actually a little bit challenging for us to figure out on our own. I mean, like I wish it were super simple because then people would be able to kind of figure it out, but then also I wouldn't have a job, right? So like this is a specialty amongst a specialty. It's not always so cut and dry. But honestly, I tell people like if you don't have access to see someone in person and something is going on with your bladder function, your bowel function, your sexual function, or you're going through perimenopause, or you know you will be soon, and you just kind of want to get like a check-in, a baseline, learn some kind of preventative tips, or learn how to optimize your health as you go through these changes. If you can see someone like me, I actually think it's a really good investment of your time and money, even for one session. Um, but if you want to figure out what's going on in your body, you can use your finger. Like I often tell people, if you're comfortable with your body, um, use your finger, one clean finger, and insert it into your vagina. And then do like squeeze your finger and see what happens. What do you feel? Do you feel your finger being squeezed? Do you feel your finger kind of being like squeezed and pull up into your body? Can you even insert your finger? Is it painful to insert a finger or a tampon, or is it painful to have things go inside? Um, you know, if it's painful to have things go inside or things feel really tight, your fingers being like really squeezed, or it was a struggle to get it in there, you've never been able to have penetrative sex or use a tampon, like that's a good sign that your pelvic floor muscles are probably resting in a tight position, right? But if you're able to kind of get one finger in and kind of wiggle it around and it doesn't feel painful or anything like that, it doesn't feel tender, then, maybe we're okay. So what do you feel at that point when you squeeze that finger? Do you feel the squeeze? Do you not feel anything, right? So if you don't feel a squeeze, maybe your pelvic floor muscles might be on the weak side. But if you're not having any dysfunction, then obviously your muscles are doing a good enough job, right? So I also like to be very practical and logical about it. If you're not having any trouble, if you're having no dysfunction truly, and you can't feel a squeeze on your finger, maybe you're just having a hard time connecting your mind to that part of your body because you've never done it before. Our pelvic floor muscles are on the inside of our body, right? It's very hard for some of us to visualize and to connect mind and body. Like if you look at your hand, right, and you open your hand so your fingers are spread, and you say to your brain tells your hand, make a fist. You make a fist and you're looking at your hand and you see that you've made that fist. That is so easy to connect your brain and your body. Like your brain is telling your body to do something, your body's doing it, you're getting that feedback immediately that you did that thing right. how do you know that you're squeezing your pelvic floor muscles the right way? We really just don't. For some of us, it's really hard to know what's going on, especially if we've, gone our whole life never touching, never talking, never looking about at that part of our body. Maybe we were raised in some shame about our bodies. There's a lot of reasons why many of us are disconnected. So I guess, Trudy, it's hard to figure it out, but you can use your finger to try to get an idea. And I really do like think that it's a good idea to kind of meet with someone. Um, but I know that it's not always accessible in terms of like convenience to see someone and even finances. Um, but I think I had mentioned earlier that I had this online program. It's called the Pelvic Floor Mobility Program, and it's basically a series of like short videos that you can follow. They're exercise and movement based, and in that program, I teach you exercises and routines to, address pelvic floor problems like leaking and prolapse and urgency and all this stuff. But I also teach you how to connect to your pelvic floor, how to find it using your breath, using positions. So it is a nice program if you don't have access to someone like me. Um, you can kind of go through it from beginning to end and learn a lot about how to make that part of your body do what it needs to do. But yeah, I think the best way is to use your finger or to try to find someone that can help you, especially if you're having symptoms.
Ladies, please check the show notes because the link to her program will be there. So you can use it wherever you live, not just for my ladies in Toronto. Ooh,
Yeah.
girl, you're sharing a lot. I'm even learning a lot here.
I'm happy.
That's why you're here, girl. Now, so we just spoke about incontinence. So
Yeah, yeah, yeah.
incontinence is weakness of the bladder. Let's talk a bit more about prolapse.
Okay, but can I just interrupt and correct you just really quickly?
Yes, please go ahead.
No, so incontinence isn't necessarily weakness of the bladder, when that might be like a way to explain it amongst friends, but truly incontinence is involuntary lack of pee or poop.
Involuntary lack of pee.
Loss of pee. Sorry, I think I said lack, but it's the
Yes.
involuntary loss of urine, right? So
Okay.
whether it's one drop when you have a sneeze, whether it's like a gush of pee that comes out when you jump, whether it's an emptying full bladder when you're running, like any of those, like any involuntary loss of pee would be considered incontinence. And it can be because of weakness of the pelvic floor muscles. It can be because of prolapse. It can be because of overactivity or dysfunctional muscles. It can be because of a lot of things, but that's more accurate definition. So I hope it's okay that I interrupted you.
Yes, yes. Thank you for that. Let's talk about prolapse. I'm
Okay.
happy that you defined incontinence, and this is why I said I love defining things so we're on the same page. Could you define prolapse and what that's about?
Okay, so prolapse, or pelvic organ prolapse, I think this is like a really scary thing for people to Google, and everyone has an auntie that, one day told them about this thing that happened and their bladder fell out or their uterus fell out or some kind of really scary story. I think everyone has some kind of horror story about an elder in their family that's had some kind of prolapsey thing happen. So I
Mhm.
recommend not Googling it because it can get scary. But really, what prolapse is when one or more of your pelvic organs are sitting lower in the pelvis than they used to. And so that can mean that the bladder is sitting a little bit lower, not as well supported. It can mean that the uterus is sitting lower or the rectum is sitting a little bit lower. And those are the three more common prolapses, but we can also have a prolapse of the urethra, which is the like the whole area, like where the pee comes out of. And there's other types of prolapses as well, but the most common pelvic organ prolapses would be the bladder, the uterus, or the rectum. And it's not necessarily that the bladder or the rectum is going to fall, right out of your body and into your hand one day when you're on the toilet. But it's more like the structures, like the muscles and the ligaments that typically hold those pelvic organs in the correct position, that whether it's over time or through habits or through events like birth or chronic constipation or chronic coughing, maybe, that those structures that hold things up in place are stretched out a little bit. And so they're not holding the structure, the pelvic organ in the right spot. So what's happening is the pelvic organ, the offending organ, is sort of crowding into the vaginal canal.
How many
So,
percent of women experience this, Aliya? And
oh, this is a good
what
question.
causes it? It's like, is it hormonal related? Is it? Mhm.
That's a good question. Okay, I do not have the stat offhand in terms of the percentage of women, but it's high. It's very, very
Okay.
high. Yeah, it's very high. And the major risk factors of developing pelvic organ prolapse are vaginal childbirth, chronic constipation, chronic straining. So if you're, sitting on the toilet and you're pushing and that's your normal and you do that all the time, if you have a chronic cough, or kind of like lifting improperly. So you can see that it's this downward sustained repetitive pressure downwards onto the pelvic floor that can stretch out or weaken the structures that typically support those organs. So I don't remember the percentage. I'm so sorry, but it is fairly high. It's not just a childbirth thing, but that is one of the major risk factors. But the neat thing is that sometimes we can have a prolapse and we may not have any symptoms at all, and that's totally fine. That's nothing to be concerned about. And sometimes we can have a very, very minor prolapse, meaning that there is some descent or lowering of one or more of the organs, but we have really bothersome symptoms. And the symptoms can be sort of feeling like something is like bulging down there, feeling something when we wipe or clean ourselves, or even seeing something at the vaginal opening. And like I said, it's not necessarily that the bladder or rectum are going to fall right out, but they're sort of crowding into the vaginal canal. They're sort of bulging into the vaginal canal, and that's what we can sometimes feel.
Okay. Okay.
Did I scare you?
Yes and no. Knowledge
It's
is power.
It's not scary. It's like I really don't want people to be scared about it. Like this is something that I have talked about it on my social media now and again, and I think on my own podcast too. But after my son's birth, I ended up with a prolapse. I pushed that dude out for like 4 hours. Like no guff, I'm gonna have some shifting of something. And for the first like long while after he was born, I actually didn't have any symptoms, and I started to have symptoms when I started to increase my physical activity level and got back to lifting. And that's when I started to have bothersome symptoms. And I think he was big by then. He might have been a year and a half. And the symptoms were very distressing to me. I didn't like the way that it felt. I was worried that I was going to make things worse by just doing the, most basic things. But with time and with ongoing strengthening of actually, truthfully, the rest of my body, like my glutes and my hips and my core, and learning how to, ensure that I was breathing and engaging my pelvic floor appropriately to support my body as I moved and lifted. Now, like I routinely deadlift and squat over body weight, and I have no symptoms ever. Maybe like 1% of my year I'll have symptoms, and um, many people that come to work with me with prolapse symptoms were able to like get nice resolution of symptoms because we can't really change where those organs are going to sit with therapy.
Mhm.
But we can change our symptoms. And the stronger that we are, right, the stronger hips and glutes and core that we have, the more supported those organs can be. And it can really help our symptoms as well as like little lifestyle tips, right? Like just learning how to poop better so that we're not putting a lot of downwards pressure onto our pelvic floor, making sure that when we're lifting grocery bags, children, grandchildren, weights, that we're using our breath appropriately to manage pressure better. So it's not all going down onto the pelvic floor.
Okay, you're gonna have to elaborate a bit more on that one, especially the pooping better.
Ah,
What?
I love talking about poop. So I guess if we want to really simplify it, maybe we can think about prolapse as like a pressure, maybe a pressure problem or something that we can mitigate symptoms by managing how we create pressure in our body. So if you're pooping, um, and you're having nice, regular, soft poops, right? They're not constipated. You're not going just once a week and straining this big, hard log.
Mhm.
Ideally, we should try not to be like straining to push that out. Straining and holding our breath to kind of poop, that's a lot of pressure downwards onto the pelvic floor. Now, when we have prolapse, um, we want to try to avoid it. We don't want to be like scared about it. It's not the end of the world. Of course there's times where I like push a poop out, and I'm sure everyone does. But if that's our like regular habit, it's good to try to change that habit and to set up our poop so that we're able to poop easier. So making sure that our poops are soft, right? So if you have a prolapse or if you have symptoms of heaviness or pressure, down in the pelvic floor, even if like you've never seen someone and no one's ever told you that you have prolapse, if you feel like you have symptoms of heaviness or something's like falling out of your body, that's what you feel, check your poops. Make sure that you're having enough water eating enough fiber, moving your body every day, making sure that your poops are nice and soft. We want them to be like soft and smooth, squishy like a ripe banana. And then you want to make sure that you're not holding your breath. Like, when you take that big breath and your face gets really red and you strain to go poop,
Mhm.
we want to try to maybe like use our exhale breath to generate that pressure. So kind of like like breathing out like that, or even holding your fist, making a fist and then holding that fist up to your mouth and blowing into your fist. That can create a lot of pressure, but you're not only letting the pressure go down onto your pelvic floor. It's coming out of your mouth too, if you understand what I mean. So trying not to hold our breath to strain. And also like setting up your poop, like get a stool that you can put your feet up on so that you actually have more space in your rectum for the
Mhm.
bowel movement to kind of pass through. Because when we sit on a toilet, just the position of toilets these days are a little bit higher than they used to be. The position that our pelvis is in and that the muscles are in when we're sitting on a normal toilet is sort of in a shortened position. The pelvic floor muscles that are sort of supporting the rectum are short and tight. So they're sort of creating a little bit of an angle or like a kink in the rectum, which makes it harder for anything to pass through, whether it's hard or soft. But of course, it's going to be harder if it's big and hard to pass through a smaller space. So if you put your feet up onto a stool, you're sort of mimicking a squat position. And when our body is in more of a squat position with our knees higher than our hips, the muscles that support the rectum are a little bit looser. So the space in the rectum is a little bit bigger. So we have more space for poop to pass through. So we don't have to work quite so hard. So that's a really good tip. Doing all the dietary things or even considering taking like a fiber supplement, or my favorite tip, because it's really easy, is just to have a glass full of chia water every morning. So it's just like a cup of water, a spoonful of chia seeds, stir that around, walk away and come back in a few minutes and the chia seeds will have fluffed up. It's a great source of fiber. Doesn't taste like anything and it's really easy to kind of get it down. And these types of things, like adding these little fiber habits in your day, can bump up our fiber intake. And stats show us that most of us are not getting adequate fiber. We should have between like 25 and 35 grams a day. And if we add it up, unless we're intentional about it, we might not be getting that. So, doing all the things to have the soft poops and then positioning yourself and then trying not to hold our breath. Those are important things that can help reduce how much strain we're putting down onto the pelvic floor, especially in the context of prolapse.
Oh, thank you so much. Oh, see, ladies, I told you she was going to be sharing gems to help you. So I have a few more questions here.
Yeah,
What
go
are
for it.
so we kind of touched on some of the causes um, of pelvic health issues. And you previously mentioned something about sex, painful sex.
Mm.
Is there a correlation what's the correlation between pelvic issues and painful sex during peri and postmenopause? Because this is something a lot of women complain about. They want to have sex, they still like their partners, but it's so painful and they can't seem to find relief. What are some of the causes of that, and what can they do to help alleviate it?
Well, at those phases in life when we're going through perimenopause and beyond, those hormonal fluctuations that we were talking about, they can
Mhm.
really impact sort of the moisture, lubrication, and sort of the tissue quality down there. So the vulva is what we see on the outside. So if we were to touch and look at our body externally, like everything inside our underwear, that would be our vulva. That's the outside, right? And the vagina is actually on the inside. Our body naturally will make moisture and lubrication, and the tissues down there of the vulva and of the vagina at the entrance and inside, our body makes natural lubrication and moisture so that the tissues are like nice and plump and healthy looking, right? As we get older, as we have hormonal and age related changes, we might experience dryness and thinness of the tissues down there. So, not making as much natural moisture, not making as much natural lubrication, and having thinness and sort of like, yeah, just like thin, delicate tissue down there. The tissue is always delicate, but not as plump, right? We might notice that like things look different down there. And that dryness and that thin, delicate tissue can result in painful sex because we may be like emotionally and psychologically like, I want to do this. I'm excited. I feel aroused, but our body may actually not be catching up to us because of that natural decrease in moisture and lubrication. lubrication is something that happens as part of our sexual arousal process. And it takes most women longer to have the physiological changes of sexual arousal, right? So, like lubrication, whereas, like, if we're with a partner that's a man, within 30 seconds, they're ready to go. And for many of us, we're not quite right. We may feel ready, but our body might not be catching up to us. When we're going through perimenopause and menopause, that sort of like lubrication piece can really be a big hindrance, and it can result in pain with penetration. So whether it's initial entry or just like repeated thrusting, we can have like, okay, listen, anything, two dry things moving on each other just doesn't feel good. The more lubrication and more slippery things are, the less friction there is, the better it's going to feel. Um, and delicate tissue on top of that really needs lubrication. So, lubrication can be one of the kind of big culprits. There actually is like this sort of umbrella category of menopause symptoms called the genital urinary symptoms of menopause, which relates to any changes happening to like our genitals and our urinary tract system. And this kind of dry, thin tissue, lack of moisture and lubrication is under that umbrella. So anyhow, this is why it's really common. We can get micro tears. It can be very painful. Um, but a really important first line of treatment options is honestly to get a good lube and just use a lot of lube. It doesn't mean it's going to fix it for everybody, but it's an important piece. Another piece outside of like sexy time is to make sure that you're replenishing moisture from your vulva and even your vagina. So lubrication is something that we want to use when we're having penetration or when we're having sex, right? Lubrication makes surfaces slide on each other better. Moisture is just like, in the morning, maybe you have your facial routine, you put cream, you put moisturizer, you put whatever. Maybe you have a night cream that you put before you go to bed. You're trying to replenish moisture into your skin, right? So that is something that you can do for the tissues down there too. There are vulvar moisturizers and vaginal moisturizers. There's many non-hormonal options, and there's some hormonal options as well. There's actually some really nice non-hormonal options out there that have an ingredient called hyaluronic acid. I don't know if you've ever had a product or have a product that you use on your skin for your face that has hyaluronic acid, but it's really good for aging skin. And so some studies have shown that vulvar moisturizers that contain hyaluronic acid have a really positive effect on general moisture and really help to replenish things down there. So there's some really nice products out there. And a vulvar moisturizer is something that you would use outside of sex. So it would be part of like your daily self-care routine.
And what I learned from an OBGYN I even had as a guest on my podcast, coconut oil. A lot of us have coconut oil
Hmm.
at home, very inexpensive. You can either swallow some every morning, so that helps to keep everything moisturized, or put it on the vulva or insert it. So that's another option for you ladies.
Hmm. Yeah.
So does exercise like weight training hit, lack of sleep, stress, managing your stress? Do any of those impact the pelvic health? If so, how?
I would say yes, because I mean, the way that I approach things is that, we're all so much more than just our pelvic floor and our pelvic floor problems or concerns, right? Like our bodies don't just work in sort of individual parts or compartments. It all is influenced by our overall stress, our social support, our nutrition, our sleep, all of these things, right? Sometimes these things have more of an effect on our health than actually what's happening with our body in terms of like, the muscles or the systems inside. So yes, I do believe that stress and sleep and resilience and all that stuff does affect our symptoms. Because you know what? It's really common for us to understand or even to experience in our own bodies that when I'm stressed, I clench my jaw. When I'm stressed, my neck hurts or I pull, I have tension in my neck. Um, this is really normal, right? Like, is it surprising when I said that, or can you relate to that?
I can relate. And this is something I would tell my clients, for a lot of women who may be experiencing bloat or some sort of gut issues, I'm like, our stomach have muscles. And
Mm,
when we're stressed, or muscles, the muscles we know, the smooth muscles, the skeletal muscles like our shoulder or on our back. I'm like, those tense. So imagine other muscles that you can't see that are in your body. They're tensing also and not functioning properly, right?
Hmm.
So, and
Yeah,
when it
our
comes to the digestive system, if it's tense, your food, if you're stressed, the muscles in your stomach is going to be stressed. You're going to experience issues digesting the food and you may experience bloat. So this makes sense if you're stressed, why you may experience pain during sex or
mhm.
even with pooping, right?
Yeah, for sure. I mean, there is the whole concept of the gut-brain axis too, right? There's a real we're learning so much about how our brain and even our mood is affecting like what's happening with our digestion. And even, anecdotally, a lot of people that when they get stressed out, they're constipated or they're stressed out and they have like diarrhea poops because they're stressed. Like this is very common. Sometimes even can make little jokes about that because it's common experiences. So, the pelvic floor and the muscles in and around the pelvis are really common places for us to hold stress and tension as well. But maybe we don't realize it, right? Maybe we're always holding our bum really, really tight. Maybe we're always sucking in our belly. Maybe we're always holding in like the muscles of the pelvic floor. This can happen to us, as a kind of subconscious reaction to stress, or maybe it's a trauma response. If we've had some unfortunate incidences in our life, we may be holding on to some stress in very kind of private, personal areas. And that absolutely can influence any symptoms that you have. It can bring on symptoms too. So I do think that everything that's happening in our life outside of our pelvic floor can absolutely impact our symptoms. I do believe in taking like a whole person approach, and I think that's a good way to approach things. And when it comes to like strengthening and lifting weights and doing HIIT, I think that the more active that we are and the stronger that we are able to generally take better care of ourselves and our whole body, including our pelvic floor. A pelvic floor that is super strong will only benefit from glutes and a core and hips that are strong too, right? And same, it's a really important piece of the puzzle to be strong outside of the pelvis, to impact the symptoms that are coming from the pelvis too. So I'm a big, huge fan of being active. And then when it comes to aging functionally and aging gracefully and aging independently, hands down, we need to be strong. We need to be mobile. We need to exercise in all the different ways so that we're able to, get up and down off of the toilet when we're 70 years old, that we can climb up the stairs more than once a day without being winded at the top, right? That we can reach really high and get that thing or bend down low and get that pot at the bottom of the cupboard. Like function is really important. And as we age, the quickest way to lose function is to stop moving. It's really hard. If you think about it, like if you think about, an elderly person who maybe doesn't have a very high activity level and they're frail or they're weak or they're afraid. And they don't do much other than, maybe eating their breakfast and then moving and sitting on the sofa, maybe watching some TV or chatting on the phone or, catching up with people. And, it's really hard for them to get up and down off of a chair. Well, if every time you get up and down off of a chair, up and down off of the toilet, if that's like your maximum capacity, that's really hard, right? That's really no wonder you're gassed from just doing these basic tasks. But if we can, stay active and we can be squatting with dumbbells well into our 60s, 70s, and 80s, then those day-to-day tasks getting up and down off of a chair on the toilet, that's no big deal because you can do it with a dumbbell in your hand for multiple reps, right? So we can't have like getting on and off the toilet be our like 1 rep max, if you know what I mean, if you speak like
Mhm.
that kind of strength training language.
I like to say we don't get older, we don't age because we don't get older because of the number. We age or get older because we stop moving. And people don't
Totally.
understand that. So a few
Well,
more questions.
yeah, it's really hard to understand that. I think until you experience it. I don't know. I really do feel like it's one of those things that we say often, but it can be hard for some people to accept.
And I think the people that's hard to accept, where it's hard for them to accept, it's they have to have some sort of traumatic event where they realize, oh crap,
Mm.
everyone was right. Now I have to start moving more.
Yeah.
Unfortunately, that's what it usually takes, some sort of scare, right?
Yeah, maybe you're right.
So let's talk about Kegel exercises. They seem
Okay.
to be the go-to exercises for pelvic health. Like we all see it. Oh, do Kegels if you're peeing uncontrollably. Kegel seems to be the go-to. Are
Yeah.
they the best exercises for the pelvic health? Why or why not?
I think that okay, so first let me just define what a Kegel is. So a
Oh, yeah,
Kegel
sorry.
is just a Kegel is just simply a contraction and a relaxation of the pelvic floor muscle. So kind of lifting and squeezing the pelvic floor muscles or, holding in a fart or stopping the flow of urine and then letting that go. So it's the lifting and the contraction and then the relaxation following it. So that's what a Kegel is. It's just a contraction of the pelvic floor muscles. It's called the Kegel because there was this male doctor that, I guess decided that we need to be strengthening our pelvic floor muscles and he named it after himself. His name was Dr. Arnold Kegel. So, of course. So, anyhow, I think that it's important to have muscles that function well, of course. I think that if you do have weakness and you're doing Kegels a reasonable amount, so not like hundreds a day. I've literally have patients that have told me that their OB said that they should do like 3 to 4 sets of 100 Kegels a day. I'm like, how is that possible? Would you even do 400 squats a day and expect to be able to walk? So we don't need to do so many. We just need to do them correctly, maybe. And that's a tricky part is some of us don't even know how to contract the muscles down there. We don't even know where they are. It's really hard. Sometimes we're squeezing our butt cheeks, like our glutes, or we
Mhm.
are pushing down instead of pulling the muscles up. So, doing them correctly, I think there's a time and a place if you have weakness. Now, if you're someone that has muscles that are tight or overactive, doing Kegels might actually make your problem worse, to be honest. And this is something I see a lot, right? People might be searching online or on social media for, pelvic pain, pain with sex, this, that, and the other, and then they come across something that says, "Oh, like do your Kegels," and so they start doing Kegels, and maybe those sensations or those symptoms get worse. That's really common. So I think that
Mhm.
there's a time and a place. It's good to have the muscles strong, just like any other muscle. It's also good to have the muscles functional. So working with other muscles and working at different times, not just maybe squeezing and releasing dozens of times. So I guess my answer is that there is a time and a place for sure. It's important to do them properly, and it's really hard to know if we're doing them properly um, on our own sometimes. And in some cases, it might actually make our problems worse.
Okay. Thank you so much for that. When should a woman see a professional about her pelvic floor instead of running to Dr. Google?
um,
That's gonna
I
scare her. That's gonna
Yeah,
scare us.
there's scary things on Dr. Google for sure. Honestly, I think that if it is within someone's capability to go and see someone, if they're having any kind of bladder, bowel, or sexual dysfunction, or they're going through, pregnancy, postpartum, or perimenopause, I think that the amount that you learn about your body by coming in to see someone like me and having a pelvic floor exam, whether or not you have symptoms, I think it's really invaluable. You can learn a lot, and then you can know what to do, or maybe you don't need to do anything, right? Um,
Mm.
if you're having symptoms like, leaking or difficulty holding your pee or difficulty emptying your bowels properly, or pelvic pain with sex or prolapse, like then I do think if you have someone around, I do think it's very valuable. Um, I think that Google, just like, we talked about before, that now when you want to seek out information, there's so much information that you can actually find, but it is very challenging to figure out who to learn from online. So if you want to go down Google, or social media, I would just make sure you're learning from people that are actually specialists in the topic that you're wanting to learn about, as opposed to people that maybe have gone through it themselves. So, someone that has had a baby is not necessarily the right person to learn how to prepare for birth or to recover postpartum just because they did it and they recovered and they look nice and trim, or, necessarily learning about perimenopause or menopause from someone that is beyond that and, seemingly thrived. If they don't have the proper up-to-date evidence-based information or education behind them, I would be wary. I think that it's society and brands and people, when there's an opportunity to take advantage of people who might be in a vulnerable state, this is going to happen. So I just don't want people to consume information that might hurt them. So seek it out online if you want to, but just make sure you're learning from someone who's actually a specialist. and wear your critical thinking hat all the time. And yeah, check in with someone if you have any symptoms and if you have the capacity. I do think it's very valuable, even just one appointment.
Thank you. And last one, what advice do you have to share? What professional advice, expert advice, would you like to share with us on how to maintain our pelvic health as we mature? Any preventative measures that could reduce the further pelvic health issues down the line? What would you like to share with us?
Okay, let me give you some really kind of actionable ones. So firstly, just make sure that you're drinking enough water, even if you leak or even if you feel like you have to pee all the time. A lot of the times we'll restrict water because we're like, oh, I'm going to leak or oh, I'm going to be rushing to the bathroom. It's counterproductive. So gradually increase water until you're drinking like a reasonable amount. Trying not to go to the bathroom unless you have to go to the bathroom. Okay, so don't empty your bladder just because you walk by a bathroom or you're worried that you won't find one later, and kind of respond to the urge that you get to go to the bathroom kind of calmly. We didn't have a chance to talk about it today, but the bladder and the brain are very highly connected. And a lot of the times when we have these uncontrollable urges, there is a component that's behavioral too. So just making sure that you're responding to the urge calmly, that only going when you need to go. These are good tips for bladder kind of health and urgency. The hydration bit will also help you with your poops, but doing everything that you can to have regular and soft bowel movements so that you're not straining to go. That is a good health tip for your pelvic floor, but I think also for just general wellness. For sex, always use lube and communicate with your partner at all times and make sure that you make time for self pleasure, whether that's like sexual self pleasure or just enjoying that delicious cup of coffee you're going to make, or that meal, or that book, or that conversation with a friend. So making sure that you find time for pleasure and prioritize your own pleasure, and not being afraid to seek out kind of help when you feel like things are changing. Like you mentioned before, some of our medical providers might not have all the training that they probably should have to understand, our population as we're going through these phases. But just keep advocating for yourself and find out what kinds of people are in your neighborhood or in your community or online that can help you. I don't think we need to suffer through. I do not want to suffer through this, and so I don't think anyone should suffer.
Thank you so much, Aliya, for sharing your knowledge with us. Before we go, could you just remind us where we can find you on social media, how we can connect with you, all that jazz?
Thank you so much for having me. Okay, so social media, I like to hang out on Instagram where I share pelvic floor education and tips and exercises. And on my stories, I share a little bit about my life. And you can find me at Box Wellness Co. My website is boxwellness.co. And over there, you'll be able to find information about coming to see me in person and booking an appointment in Toronto or finding one of my online programs or any other free resources I have there. There's also a lot of education on my website as well. And then my podcast is called the Not Your Mother's Pelvic Floor Podcast. And you can find it on Apple Podcasts or Spotify or wherever you like to listen.
Thank you so much. And as I said before, ladies, her Aliya's contact information will be in the description so you can connect with her. Thank you so much for joining us. I had a great time.